60% said fiction, 40% said fact. And the answer, Samir, next slide.
So that's fiction. A little bit of a trickier one, because I will concede that it's milder than Delta, and that's important. You know, to be fair, inherently, it's less likely to cause severe illness. It's less likely to kill people, whether you're vaccinated or not, compared to Delta. But to be fair, when you're comparing to something really severe, even though it's less severe than something very severe, doesn't make it mild. The other thing to think about is just how transmissible it is. It's 3 to 4 times more contagious than the Delta variant. And so even if you have something, let's say that's 1/3 as likely to kill someone, if 6 times as many people get it, which is about the order of magnitude with the 6th wave, twice as many people will still die. So the impact on our society, on our healthcare system, we're all feeling that impact, is still massive of the Omicron variant. The other thing with respect to the healthcare system is sort of early in the earlier waves, it was often that we were there, healthcare workers were there, but there was too much demand. There were too many patients. We didn't have enough equipment, beds, et cetera. Whereas later with the 6th wave, what's been different is that society is largely vaccinated so that the severe illness is reduced. So the demand isn't as increased, but healthcare workers have often been exposed because it's so transmissible. So we've had isolation, we've had, in some cases, quarantining. And as a result of that, there have been less healthcare workers. So the supply and demand issue still was there in the 6th wave, where we still had a hard time sometimes keeping up with the patients in hospital. And the last thing I'll mention is always to keep in mind long COVID, the possibility that 15 to 20% chance of people getting long-term symptoms. Even if they don't get severe disease, there's always that possibility. So no, it's not mild.